I was a medical student at Ohio State, and Dr. Robert Zollinger, who is sort of the father of the clinical discovery of PNETs, or pancreatic neuroendocrine tumors, was the chairman of the Department of Surgery at Ohio State. And he was talking about sort of the puzzle that these patients presented, and this was in the mid-1950s, 54, 55, when they had massive diarrhea, massive ulcer disease, and they couldn't figure out why these people had a tumor in the pancreas, and they had massive ulcer disease. There were no radioimmunoassays for gastrin or any of the other peptides that these tumors made. All they knew was, here's a patient who had a pancreatic tumor and had massive ulcer disease and diarrhea. And it took them 5 years to try to figure out what it was that the tumor was making that caused diarrhea. And I remember as a medical student sitting sort of in total rapture, listening to this guy talk about, here's a tumor, here's the clinical problem. We knew there had to be a chemical messenger, but we didn't know how to find it because a radioimmunoassay didn't exist. And it was McGuigan and his team and Dr. Yallo, who created the radioimmunoassay in the early 60s, who allowed us to discover what the heck these tumors are making that cause the patient to be ill. The tumor can be very small, 1 centimeter, but the clinical problem is overwhelming. Your stomach literally eats itself from the inside out because this little teeny tiny tumor is making a chemical that makes your stomach make gallons of acid a day rather than a few ounces of acid a day. And other people then, very shortly after Dr. Zollinger and Dr. Ellison described this Zollinger-Ellison tumor, another group of people found another very small tumor that created what was called pancreatic cholera. These people would literally have 3 gallons of diarrhea a day, and they would die of electrolyte imbalance. At the charity hospital where I work in New Orleans, I didn't believe the stories, but they had what are called cholera beds. Imagine now you would a gurney with a hole cut out underneath your butt, and as you have diarrhea, it goes down in a cylinder, and that cylinder is marked off in volume. And so each hour, the sister, because it was a Sister of Charity's hospital, would come by and say, oh, look at you, Dr. Woltering, you had 500 cc's of diarrhea last hour. We'll give you 500 cc's of fluid intravenously. And again, it took a decade from the relationship between a teeny tumor and having gallons of diarrhea today to finding out that that chemical messenger was, in this case, vasoactive intestinal peptide. So I was fascinated by the fact that you could have these chemicals that were floating around in your body that were normal to you and me, but now were being made by pounds worth when you and I make 1 milligram or 2 a day, and that these overwhelming clinical symptoms were due to teeny tiny little tumors that may have never spread. And so that's how I got interested in doing this. I graduated from medical school in 1975, and I never lost my interest in trying to figure out how to assay for these unknown messengers, how to find the chemistry that would maybe unlock the door that we could turn them off without having to operate on them. And it turns out that something were the somatostatin analogs, octreotide, lanreotide, those kind of things that turned off the key. It was the key for the lock that turned off the tumors.